Hello, this is the Landscape Ontario podcast. Today we feature the audio from the July 7th, 2020 Town Hall webinar from LO's COVID-19 Task Force. The group this week was joined by Becky Hester from York Region Health to discuss best practices for employee health. Stay tuned, it's coming up next. The Landscape Ontario podcast is sponsored by Dynascape Software. LO members save 15% on Dynascape products, software upgrades, and online training. Visit dynascape.com for details.
All right, hello and welcome everyone to today's Landscape Ontario's Town Hall. Of course, brought to you and organized by the Landscape Ontario COVID-19 Task Force. Today's Town Hall is being recorded, and the recording will be sent out so that you can review it on your own time and as your own unique schedule allows. So we do ask that you ask lots of questions, and I'll be monitoring the chat on the right-hand side. So please do ask your questions there, and I'll do my absolute best to make sure that we get to as many of them as possible. Balancing the operations of your business and the safety and the well-being of your team can be a precarious tightrope. And without dealing, especially dealing without a global pandemic, it's important to remember that as employers, we have obligations to protect our workers from the hazards in the workplace as set out in the Occupational Health and Safety Act and its regulations and the directives coming from the Chief Medical Officer of Health. The health and safety of our people must continue to be a top concern amid the global COVID-19 pandemic. During this time, everyone must place an increased focus on health and safety in order to keep job sites open. Don't let your guard down. The LO COVID-19 Task Force felt so strongly about making this a topic of our town hall. So here we are today. My name is Joe Salami. I'm the Deputy Executive Director of Landscape Ontario. And joining me tonight are Alan White of Turf Systems, our Task Force Chair, Jeff Olson of BTN. He's on our LO Board of Directors and on our task force. Peter Ganane of Oriole Landscaping on the LO Board and task force. John Dursey of Miller Waste Systems on the Board of Directors and the task force. It's a star-studded crowd tonight. And our special guest, Becky Hester. She's the manager at York Region Public Health. Her regular portfolio includes recreational water, including pool, spa, and beach inspections of small drinking water systems, and assisting with accommodation inspections for seasonal farm housing. Now, it's all that and anything COVID related to that. Becky and her sister own a tree farm near Caledonia, Ontario, and she told me that she has nothing remotely resembling a green thumb, but is an absolute awe of anyone that can grow anything. So welcome, Becky. I really appreciate you taking the time to join us today.
Thank you, Joseph, and thank you, Landscape Ontario. I was so interested to hear that you had a task force, and so impressed by that.
Yeah.
All the work that you've done, and I know that you've had previous webinars, so I wanted to thank you for the opportunity to come and speak with you too.
Well, we really appreciate you joining us. The Landscape Ontario COVID-19 Task Force just had our 50th meeting since the start of this. Yeah. Becky, I'd like to start with you, I'd like you to talk to us a little bit about what exactly a mobile testing station is. I know that you were instrumental in the region of York in setting that up. What exactly is a mobile testing station, and what happens when you show up?
So we were fortunate to be able to partner with Southlake, and we are going to be partnering with other hospitals as well. That request for mobile test unit came from our farms. We did send out some information early on encouraging farms to have their workers and their staff tested, and it's obviously voluntary testing. But we thought it would be good to try and get ahead of perhaps outbreaks, and if we had positives that we could help mitigate the spread, and that's really our role in public health. So that request came from our farms and different advocacy groups and so we took that through our health emergency ops center, and they were able to coordinate that through their liaison group with South Lake. And so we had our first round, and I believe, Jeff, your farm was the first one. And I'm hearing from Jeff that it went very well. I had another farmer, I did ask for feedback after to see how the testing went, and it was fairly smooth. There's quite a bit of paperwork up front, I understand, and a lot of labels, and the more workers you have, the more it's a bit of a process. But South Lake was fantastic in setting that up and arranging and sending things ahead of time. So the feedback I heard is that it really was great to have them come to the farms rather than farms having to go to assessment centers when really didn't necessarily feel comfortable leaving. They've really tried so hard from our experiences to keep people on the farm and to not be going out, or at least restrict going out as much as possible. So I hope that answers your question.
Yeah, and maybe a follow-up. So when, as a mobile testing station, when you actually show up, first of all, what is the lead time that you need in order to have that mobile testing station come and see you? And
So
what happens when you get there?
We've been providing the list of interested farms to the hospital, and then they've been calling, and they've been very proactive in trying to arrange it fairly quickly. And their doctors and nurses, from what I understand, are on, they have certain days that they can do the mobile. So some are mobile testing stations in the community, but then some are on-site visits at farms too. So we've seen anywhere from a week lead time to 2 days, really, where they've been able to organize really well. And we've been trying to work with them around their schedule. So
yeah, with the amount of work involved to set that up, that's a pretty quick turnaround.
Yeah, they've been fantastic.
Yeah. And so when you show up, what with the mobile testing, what does it look like for the business, the employer there?
So I don't want to put Jeff on the spot, but I think he might actually be better able to answer that. Jeff, are you comfortable? Because I haven't attended, so I've just heard the
okay.
I'm absolutely comfortable to go through that. I could actually show you guys a slideshow if you'd like me to fire that up now. It's like 4 slides or 5 slides, and I could run you through the whole process that we experienced anyway.
Why don't we do that, Jeff?
If that would make sense. Now it's up to you guys.
And we can ask some questions.
Mm-hmm.
Yeah, sure.
So do you want to come back to that?
Absolutely, yeah, definitely.
Okay, thanks for rescuing me, Jeff.
No problem.
Just like to give context, and then we can go into, again, more of the prep, more of the afterthought, more about public health and some of the things you're seeing. But yeah, maybe Jeff, because your slide deck gives a kind of visual of what your nursery went through.
Mm-hmm.
Sure, Joe. I think you got to give me the power to share over here.
Is it asking you about that?
No, it just won't do anything when I. Let me try that again. I'm going to go on top of it here.
That's part of the alarm
test.
Yeah, it worked fine in rehearsal.
I know, and it was fine, but I don't know. Not that we rehearsed it to this. No, I can't share it.
Oh.
So we can come back.
That's weird. Yeah, let's come back to it.
Yeah.
And I'll try and get my technical stuff worked out here.
Yeah, and in the meantime, Becky, we have a few sectors in the industry here that are using the temporary foreign worker program, and part of your inspections are for the housing of that, and now COVID related. So can you talk just a little bit about your experience, what you've learned along the way from kind of starting out till now? What does that all look like now?
So we have certainly learned a lot, and I have to say I know what a transplanter is now. I know different ways to put barriers in different types of machinery and things that we didn't ever look at on farms. And like you mentioned, we've always been primarily focused on the accommodations, and that's through the application process and supporting farms in the application process. So we've been very grateful for their help too, and there's been collaboration as well in terms of looking at when workers were arriving. And So just from the very beginning, trying to send out resources, we did focus a lot on the federal requirements, the provincial requirements, which were excellent. And then we did reach out to our neighboring health units to get information to say, what are you doing? Our ASFIO group, which is our Public Health Association of Supervisors and Managers group, that a lot of different resources went out from different health units, and they were very helpful. So we tried to pick some of the things that were applicable as much as we could to our temporary accommodations, and then we sent out some guidance and some emails. Initially, we touched base with a lot of our farms during isolation. So when we knew the dates, and we worked with farms on that, and certainly delays in workers and trying to keep on top of the different isolation dates. So we were checking in, trying to assist with some guidance that way. And then basically trying to learn about the different things. So if we had a call or a request for guidance, there was certainly really good guidance put out by WSPS, and we had shared that with our farms. We shared a lot of information. We tried to get signs in different languages. So emails, and then the notification about swabbing and looking at it from that perspective. And then to support that, trying to get ahead with some spot checks. And that's really where the learning really began, because we realized some of the things that, we thought would be helpful. Maybe they weren't as practical. So looking at trying to be solution focused and help to do different things. So the spot checks were really revealing. We tried to get ahead of the mobile swabbing on those too, and to have some of the guidance in case of any positive workers. So then trying to look at what would happen. And that's very case by case, and very difficult to hone down certain things because it's very operationally dependent. So it depends on the accommodations, but also depends on the related work on the farm, the type of equipment. And so we've learned a lot about different processes that we've never looked at. And we're learning a lot from our farmers for sure, and our workers as well.
Right. And, when, mobile testing station comes in, if they're to find that there is a positive a case, what happens when there is a positive result?
So all along in the guidance too, we've asked if there was certainly we get notified from that there is a positive, and right away that will go to a case investigator. And then the case investigator starts to ask the questions. They ask about close contacts. They ask about, has that worker had any symptoms? Because you can have also asymptomatic positives as well. So they really start doing the investigation and the digging, and then they will ask our team, so on the inspection side, to support case management to go in and ask the questions and really look at housing processes, that kind of thing. And that's not in isolation. So obviously Ministry of Labor is involved too. OMAFR has been very helpful as well. And so there's, there are different agencies have different roles in that case. So it's really case by case for farms in that investigation, and depending on if the positive is housed with other workers, then looking at, okay, close contacts, have them been able to maintain distancing? Are there other agencies? So, we've also learned there are a lot of other agencies and local supports that work on farms as well. So then when you get into the contact tracing, it gets drilled down right to, okay, who's been on your farm, who has been in contact with your workers, that kind of thing. And so our job is really to inform the case management piece and to try and look at what's actually going on, and how that COVID plan has been working.
Okay.
And then obviously backup accommodations as well. We've looked
at. Can I ask you, Becky, as you've gone through, and obviously you have firsthand from a public health standpoint through these inspections, what guidance can you give our members? I would expect it to be case by case, but you've probably learned lots.
We have.
what insight can you give our membership as to where protocols have worked, where protocols have needed stepping up, or just misses? Just having that ability or your insight would, I think, certainly help our members as they look at their own operations to see if they can learn or if they're implementing some of the misses or things that could have been better to help with your caseloads.
So we were talking about distancing just before we came on and trying to keep your guard up in terms of distancing. And so that is one thing that we found is a lot easier said than to actually do in many cases. And then when you can't do that, what are the alternatives? You know, are there different workflows, different ways you can arrange your accommodation? I mean, most of our operators have already reduced numbers. So in terms of trying to keep beds at least 2 meters apart, and you know, that's a minimum. So how can you creatively maximize space and still have 2 meter minimum distance between beds? So there've been a lot of creative things done that way. So we've really learned that distancing is really key, and that if you can keep distancing, that really definitely helps minimize the close contacts. And then we've also learned that there, in many cases, then it's not practical. So where can you have barriers, or where can you change things in terms of processes? So things like staggering lunches and how people have their lunchrooms organized. And so that's another thing we've learned. We learned early on about masking and face coverings and what would be appropriate, especially if you're working in a field. And you know, so we had a lot of questions. Our medical officers have been really supportive in providing information and trying to answer questions in a timely way. So we were able to provide that information through, I mean, we have an agricultural sector group that supports within the region, and they've done a lot of work, and questions come through there, but it's also kind of the broader sector, like OMAFRA is on there and has answered questions. So they're doing webinars as well. But I think really and truly the trend in trying to keep sleeping accommodations to keep that minimum 2 distance, and then certainly in lunchrooms trying to keep a flow. You know, we've been really reinforcing the hand hygiene, and farms have been really good in putting up their signs and educating their workers all along the way. I think that's made a big difference, is just that reinforcement of all the COVID precautions, but primarily that distancing.
Mm-hmm.
And then can't do that. What can you do?
Right.
With Foreign Worries, have you found things that have worked really well with some of the groups that you've met with in dealing with offshore labor, where there may be a language barrier, a culture barrier, as it relates to lifestyle, or just the things that they would consider normal practice? Is any advice there on things that have worked?
So I think the demonstrations have really gone well. So I know when our inspectors have gone on where they've had an opportunity to do the demos, and anything visual. So the masking demos that are on the different websites are very good. We have one on ours that's quite good and talks about the process of, you know, hand hygiene and then the mask and when to change the face covering and that kind of thing. I think I got a little derailed there.
So the visual versus written.
Yeah, so definitely.
Demonstration.
Yeah, definitely visuals, and the federal government did provide signage in multiple languages. So we're seeing the language signs up and being reinforced. But I think it's really the farms that have had the upfront COVID plans upfront. I think that's where, you know, you really see, because it's been from day one. They've put in place all the precautions, the signage and everything, trying to organize flow. So I think, to answer your question, I think those COVID plans are really key and really helpful. And a lot of them put them together really, you know, from resources from all over, and they did that work. Yeah. So certainly where we've had to come and check, but they did all the upfront work in trying to do plans. And in some cases for farms, you know, it's a whole new world. Mm-hmm. So.
Absolutely.
I think, Joe, you share with the viewers, people watching anyway, that at least our Don't Let Your Guard Down decals that will be shared or made available later this week are in 3 languages, from French, Spanish, and English.
Yeah.
So depending on your workforce makeup, certainly we're trying to make resources available at Landscape Ontario to deal with maybe those language barriers.
Yeah.
And your resources are very good. I meant to say that up front too. So I talked about WSPS, but I forgot to mention because I was looking at your site. It's impressive.
Mhm.
Yeah, a
so-
lot of the guidance did come from WSPS, and
Right.
you know, the COVID-19 hub. In case any of our viewers haven't been there yet, please check that out on the Landscape Ontario website.
That's what 50 meetings will do with your members.
Yeah.
And it's probably ingrained, but you were talking about the different vehicles and transporting workers and staggering those things, and also keeping the really the environmental cleaning of any surfaces. So whether it's vehicles or equipment or whatever it is, just remembering the cleaning and the disinfecting. And so I know it's everywhere that Health Canada has for the hard surfaces, they have their list of what's good. You know, I think that's on every website everywhere in terms of, you know, what products are suitable. But it's time consuming. So even the trucks, depending on where you work. So to take that time and do that environmental cleaning is really, really important. So, you know, the distancing, the hand hygiene, and then the environmental cleaning, anything high touch surface.
Becky, have you found a fair amount of companies that are using foreign workers hiring third-party sanitizers or outside cleaning companies to sanitize sleeping quarters and such, or have they been mostly focusing on in-house?
So we have seen a few. I know for portable toilets that they have, like, those third party companies are doing some of the cleaning and the disinfection. I think some of the larger firms have, you know, third party consultants even for their plans, and then they've had other companies come in and do assist with the cleaning and disinfection, or at least guidance on products. So maybe selling of products that there's guidance that's gone along with that in frequency. So it's a good question. From what I've seen, I do know of a couple. Yeah.
Good.
And Becky, we do have a question from the chat, and they're asking if the mobile testing services are available for non-farm companies.
So mobile testing has been around for a bit. So it didn't start with farms. So they were going to other places that for more vulnerable, right, populations. So I could ask that question if it's available. I think really the focus is trying to get to the places that really, I don't want to say need it more, but I think we just kind of gone more with our priority populations. Yeah. Certainly, if someone had a definite need, I think it could be considered, but that's something that I could ask.
Sure.
And then depending on where you are, right?
Mm-hmm. I was going to ask, depending on where you are, obviously our memberships across the province,
That's right.
How are the regional health units coordinating? Is it very similar across most health units? As it relates to COVID-19, has there been a pretty good coordinated effort to have some consistency?
I believe that's coordinated through the LHINs, right? And so through the hospitals, more on that end of the coordination, right, than on our end.
Right.
Yeah.
I was going to say, with your testing and you're doing site inspections, is there touch points that you're seeing are more often than forgotten that are high risk areas, or is your testing still right now at really the transmission and positive test level? You're not getting into any site specific or better understanding of how the disease is moving around.
So no, not on our side. So we're more the follow up and the information providers of what's going on the different locations. But that we do publicize all the trends on our website, as do all the health units.
Okay.
Right. And
so there's a lot of data collection, and a lot of there's a lot of information sharing. And I think that's probably one of the more positive things, you know, if you can say anything's positive in a pandemic, is that there has been a lot more collaboration, a lot more learning together, different agencies working together, agencies I really had never worked with before. Learning, I've learned a lot from, Ministry of Labor as well, and, certainly our associations.
That's wonderful.
How's Jeff coming with his IT and his PowerPoint?
Sorry about that.
I think to help demystify seeing an operation.
I did send it over to you, Joe. I still can't share. I think you've got the power to share, and I can't do it. So it's on your email, and you can probably get it going for me.
If we can't share, maybe we could send it out after.
Oh, we certainly can do that.
Yeah, because I would like to see the pictures. I would be interested.
Yeah, Joe should be able to get it up here in a second.
I think while he's doing that, we have a question from one of our members about crews riding together in trucks from site to site throughout the day. Does that make them a close contact? And do masks, face shields, plexiglass, etc., actually help with this close contact or in that confined space?
Yeah, so I actually have a definition of close contact. Send you the definition of the close contact so that I'm not wasting your time looking for it. But so it depends. So really the barriers do help. So if you're in a truck with a barrier and you also are masking and you have your face shield, right? So you have a lot of barriers right there. And then it's dependent on kind of length of exposure to that person. And certainly if that person's positive, right? So those are the questions they will ask to make that determination.
Yep.
So it may depend on how long is the drive, if it's an open Jeep and it's open air, or, if it's just a barrier. So the more barriers you have, the less likely you're going to be a close contact.
And how much is public health really kind of promoting or in agreement with this bubbling effect? So I heard you say staggered lunch hours, but both the landscape sector crews, garden centers, or on the farm level, this concept of bubbling, keeping the same team together, and then trying to make sure those teams have as limited contact as possible.
Right, and so I think it's almost like cohorting, right? So you keep those work teams together. They do their lunch together. I think it's good. I don't necessarily think it's a lot of it's dependent on the processes. So when they're asking the questions to say, okay, where in that process did you stray from that? So I think it certainly helps. It doesn't necessarily mean that someone won't be isolated separately.
I think it creates a bit of a caring culture. And, along with the caring culture comes the trust from employees, them wanting to work and be there. So I see the cohorting being a positive thing.
Yeah. Joe, I see you got the
certainly doesn't hurt. Certainly doesn't hurt, right?
Yeah, definitely. You guys can see the slide deck okay?
Yep.
That's perfect.
All right.
I can see it now.
Okay, so thanks. So first of all, we took an early aggressive approach to protecting our employees and risk management on the business. This health and safety of the employees first, and of course risk management on the business second. But part of that was all the hygiene protocols and all that jazz, of course. And then we started to go down the road of testing, and although we thought this was prior to some of the outbreaks that were happening, we were already thinking about it at that point, but we're very concerned about what we were seeing in southwestern Ontario, and knowing that our offshore employees are at high risk, we made a mandate that we wanted to see every one of our employees tested every month. Now we can't force that for everybody, but we could certainly mandate it for our temporary foreign workers, of which we have about 80 on spread across 5 locations. So our head office location has about 35 workers. offshore workers, and so this was the protocol for this team. So next slide, Joe. So we want to add an extra layer of protection for our employees. Our company policy states the following: all employees are encouraged to go for monthly testing at their local health center and share the results with their manager. BTN will pay for the off time to get these tests, maximum 5 hours per employee. So we would pay folks. So we started out by saying, we'll pay you to go for a test. And that was kind of the original thing. And we didn't go mobile testing to save money. That wasn't part of it. It was really out of convenience. And one of the big mandates was that we didn't want our temporary foreign workers leaving our farms. We wanted them to stay, never leave the farm for the 8 months that they're there. How do we never let them leave? So not even to go for a test. And so we called our local health unit, and they offered on-site testing, which was much more convenient than taking the trip to the hospital. And they would come to our business once a month to test all of our employees. Next slide. So we had to set up a test area. So Becky's team organized it with our manager of that location, and we had to set up a clean area that was controlled entrance and exit so that staff could maintain physical distance. So that's the trailer. There's a sign up. So you basically, the unit comes in, they give you sign up sheets, and so everybody gets registered. And then on to the next slide. And all the registry. Oh, sorry, go back one.
Sorry about that.
Yeah, so all persons register on site prior to the test. So that's just a photo of one of our gentlemen getting tested. And next slide. And then, so we had a combination. So we wanted all employees to get tested, but not all employees wanted to get tested. So we made it mandatory versus volunteer. And so we said the policy is mandatory for all temporary foreign workers. And all Canadian employees were encouraged to get tested and share their results with us. So that's a little bit of an interesting one, because there's a privacy issue, and will they share their results? And so we were a little bit concerned about that from a privacy standpoint, and I'll wrap that up. Let's go to the next one. And the health unit provided one doctor and one nurse. So this was once you get up into the trailer unit, then you've got one doctor and one nurse on site, and they tested 50 people in just over 1 hour. And then the results is the next slide. So a few days later, we received the results, and for everyone, and they all came back negative. So this was the interesting part as well. They shared everybody's results with us. So even those people had to put their health card in, and I guess they could set up their own account through Healthlake. I'm sorry, their own health account through Southlake Hospital. We actually received an email with everybody's results on it. They were all negative. And I think that might be a kink that may want to get worked out next time, or may not. Like, we're happy to get the results as an employer. I'm not sure if all the employees were happy that we got their results, but maybe they were. Like, they volunteered to get tested. They wanted to know their results, and nobody complained about it. It's just we were a bit surprised that the results were shared completely with us. Little funny story. So I had gone and gotten tested 2 weeks prior to this, just to see the process over at Southlake. And for anybody out there who has gone to one of the testing sites at the hospitals, they're really convenient. It's really easy. I went almost at the beginning, so the lineup was the hardest part. It was a 2-hour lineup. Today, I think it's a 10-minute lineup. It's very, very quick today. But I was, on kind of the first batch, and it took quite a while to get up there and get through. But the funniest part was when, all of our folks were smiling when they were walking up to at the mobile testing unit. Everybody's kind of smiling and kind of giggling as they were walking in. And when they were coming out, every single person had a little tear coming down their cheek, because it is a bit of an uncomfortable test. I mean, it's a second of a swab going towards as far up your nose as they can get it. which made it a little bit uncomfortable. It was kind of a cute thing to watch everybody going and smiling and everybody coming out crying, but not really, just more of an uncomfortable tear kind of going down their eyes. But anyway, it was a really great experience. It was, and I think everybody felt really comfortable with it. And the main thing was that I think as an employer, people really felt like, we were taking care of them, and that made us feel really good. And I think although it's inconvenient for people and it was a little uncomfortable, um, I think they're happy to do. We also have a full mask policy throughout the locations, and in this heat, it's not easy. It's uncomfortable for people, and I do hear complaints about it. But at the same time, I think the benefits outweigh the negative side of that for sure. So anyway, that's
Well, one, they're safe, and two, they're able to work.
oh yeah, no question of that. And I do find though, and I think you folks will see that with your teams, that the rules are getting skirted as much as they're being stuck to, and we police every location, every hour of every day. And we find, like, it's funny when I walk into a building how quickly people's masks go on. And I don't know what to do about that. We start writing people up, we start suspending people. I don't know how to take it more seriously. We have a 30-day window that we keep pushed. So we went to June 30th and we said, okay, we'll review it again June 30th. Then we went to July 31st. And so that's our next review period to review our policies. And I don't know. I don't know what the right thing to do there is.
You can remind them all of for our sector. Some were 4 weeks laid off, some were 6 weeks. There's still many sectors that are 4 months into this, and not back to work. So you got to support your family.
Yeah, for sure. Thanks, Joe.
Wonderful. Thank you.
No, thanks, Jeff.
Sorry, Jeff, I had a question. What happens with incoming groceries and food for the foreign workers? Is there a temporary or a station set up for desanitizing of groceries and such?
No, there's not. They can do that. So what we do is we have dedicated staff in each location that go to they get a grocery list from each of the guys, and they go to the store and buy it for them. Then they bring it back. If the guys choose to sanitize it when it comes back, they can. But we don't have our own team who've been tested is kind of going out there and getting it from the local grocery store. So we don't use like Cisco or a Service or Gordon Food, anything like that. We just have our own people go out and buy it and bring it back. We had a really innovative thing as well the other day. So the temporary foreign workers send money back to their families. I mean, remittances, I was shocked by this, but Mexico's second largest industry, their first largest industry is tourism. Their second largest contribution to GDP is remittances from foreign workers. So people sending money back to their families. It's unbelievable that it makes up that much of the economy. So our guys need to send money back to their families. We had a ATM set up in our location because one person, we don't use Western Union. They use they call him the taco guy. He comes around and he does their wire transfers for them. They give him cash and he does the wire transfer for them. And so that's the one person they're allowed to mingle with from off the farm, just to hand him money, and he sends the money to their family. But they needed to get cash, and we didn't want them going to the bank. So we had a bank machine installed in the location, and anybody will, if you have 20 or 30 workers, with these private ATM companies will come out and put a bank machine at your location. And so they take the money out of the account, out of the bank, and give it to the taco guy.
Wow.
Always awesome. Good to have a taco guy.
Yes, but it's an innovative approach really to getting cash. And we thought it was really, really cool that my CFO came up with that one.
Absolutely. Mm-hmm. Well, thank you so much, Jeff, for sharing your experience. I mean, that's from understanding from Becky, that's the kind of, you were the guinea pig of of that process for the farm. So thanks for going
Yeah.
through that and sharing that with us.
Oh, it was great. And thanks to York Region Health for doing, like, I mean, they were all over it and very proactive. And we just were so thrilled with how it went. And we're going to do it every month. So stay tuned.
Great.
Joe, maybe Becky could share a bit with us, working directly in the public health unit, particularly seeing what's going on south of the border. How are the conversations going here in Ontario in particular, so close to such a major metropolis area like Toronto? Our numbers are low. We've gotten ahead of this from business proactivity, health proactivity, our government and programs. What are the conversations going about what we did right? What are the biggest concerns right now of public health that we, again, our industry's fear is that we don't have a relapse, that second wave, that we're doing enough, and that an episode like what's happening south of the border doesn't happen here.
Woo!
Whoa.
Question and a half.
We'll talk around the office.
Yeah, and well, I mean, we're very separate in our office. So, but there's obviously a lot of advocacy that's coming up through the different sectors, and I feel like, you know, we are seeing trends downwards. It's a really difficult question to answer. I know that the conversations happen a lot higher than where I am.
Mm-hmm.
But I think that there's been a lot of leadership, and I think that's kind of the strength, and you're seeing it in all sectors and it's leadership. And so what you guys have done in your task force, I think, is pretty much key to what's going to make it successful. And I do believe that. Like, I think all the work and all the advocacy and all the reminders and the reinforcement and all like is really, really key. I think that's kind of make or break, right?
Mm-hmm.
And you guys were saying it before we even came on. It's sticking to your guns now, right? Because it's hard, like even just the masking to continue and the distancing, but now we have to stay the course now. Right now is really important. And I think your customers, your clients are all, everybody's learning. I feel like people are for the most part doing what they need to do to keep their families safe and keep their employees safe. And a lot of caring.
Yeah.
Really, a lot of caring. You really see it. Yeah.
John,
so
what are the folks at Miller doing or to deal with this complacency that we see across the board? In addition to what we're doing at Landscape Ontario, what are you seeing within your company that's really trying to keep this front of mind?
As I mentioned in a past webinar, we've been pretty fortunate that we have a physician throughout the company that we've been working really close with. So cases might pop up or scares. So we have the support there. But in terms of individual offices, we've really focused on all the touch points, constant cleaning. We've put up shields in front of our retail desks. Now we've recently started, as of Monday, we are moving into what we call our phase 2 of opening up to the public. So shields in front of all the desks, social distancing in the offices, one retail customer at a time in our office. Masks are mandatory. We're still holding on strong to curbside pickup. And we've put alcohol dispensers outside that have to also be used prior to entering the trailer for orders. We've also eliminated all of our samples because people like to touch and they like to look and talk. So we've eliminated all that in the office and we've really dumbed it right down. So we're just trying to be as cautious as possible, practicing social distancing, masking, constant hand washing. We've really tried to control the gathering areas at our facilities and a fair amount of signage. And that's what we've sort of been consistent with. I did mention the caring culture thing. We found that the employees are very receptive, and they're just being positive when they're coming to work. We're trying to keep it super positive and super clean and taking everyone's opinions to heart and working closer with everyone. So it's actually been very positive.
Awesome.
And John, if what kind of procedures in place for when you do have a positive case? And
So
if you have one, what's happened?
Yeah, so we've had gosh, more than a handful throughout Miller Waste Systems. The employee is tested right away, and he's told to stay home in quarantine until we receive those results. And anyone that was in the infectious area, as well as everyone on that facility, also are to be tested, and the physician sent in to do self-testing. And then he makes the diagnose if they are to remain at work or like come in the next day, or if they were to stay home and get tested as well. Each of our facilities don't operate on a fair amount of people, so bringing in a mobile site doesn't really seem feasible. We don't have like the 50 to 80 people per location. We're more of like 20, 22.
Mm-hmm.
Right.
If there is a positive test, they go through the 14-day as well.
Right. The quarantine.
Yeah.
Well, thanks for sharing that, John.
Yeah, Joe, I think maybe even Peter, you have a pretty big workforce with your company, but a lot of our landscape contract members may have upwards of 20 to 100 employees. There's a lot of small operators, obviously, and we really rely on public health, whether it's the hospital testing facilities you mentioned, Jeff, or others. But I think if the regional health units are similar, I wouldn't see that much difference in going and testing a landscape company that had 50 or 100 employees at a single location. If they felt the need of the contacts were sufficient enough to be proactive in their risk management strategy.
Yeah, I mean, like most companies, we have multiple crews. My crews are 2, 3, 4 people, and we're trying not to get larger groups together, because if there is a positive case or a suspected case, we have a similar policy as John described, where that person will get tested, will self-isolate. The people in proximity will have to self-isolate until we get the results of that test back, and then obviously they'd have to get tested if it was positive. So we're trying to keep everything separated still, and I think it's possible for us to continue that for this entire season. We've changed how we do our company meetings, training. Everything has changed, and now just yesterday the City of Toronto mask bylaw came in, and that aligns almost exactly with what our policy was already, but it gives us a bit more substance to back up our policy and more signage that we can put up, and like you were saying before, it just takes constant reminding to learn these new protocols. And I tell people it's an analogy like wearing a seatbelt. It took years for us to learn to wear a seatbelt out of habit. It's for our own safety. It's very unlikely you're going to need it, but in the event that you do encounter that risk, you want to have it on. And I say the mask is exactly the same. Yeah, it's true, you're not likely to get it or be exposed to it today or tomorrow or with these particular people. But if you are exposed to that risk, you definitely want to be protected. And it just takes time to learn. And I think we're in that learning period now in the summer with low numbers. But as the economy continues to open up and people get more complacent, I fear the numbers will rise again. And that's when the people who have learned how to be safe will stay healthy.
Mm-hmm.
Thank you. And Alan, you've leading the charge with our task force. Have you encountered any positive cases, and if so, how have you had to deal with that?
We haven't encountered any in our workplace. We're pretty diligent. Again, sometimes I feel like I live in the forest all the time, being part of the task force, thinking about this every day, getting all the news sources coming in. But at the same time, we do get the guys that come in or wake up in the morning and their stomach doesn't feel well, or they got a sore throat. So our policies have just been, and the culture piece that we talk about, that nurture, it's okay. And actually part of what we all expect of each other, don't come into work. take your health seriously, take all of ours. If we all do it together, we're in this as one, and we can help protect each other. But public health, telehealth have all been pretty good at helping mitigate that, moving the right people through the correct channels that they need to get the clearance before they come back. So some of our team members, there's probably not a week's gone by where we don't have one person off for at least a couple days. But to date, we haven't, knock on wood, with all the points of contact we do in a day with just the general public and going to the residents and leaving. Granted, it's all outdoor environments, and we know that reduces the risk substantially, but our points of contact are substantial in the GTA. So it's just something always top of mind and making it part of what we do every day. But even our own team, the amount we talk about it, that complacency piece, or the uncomfortableness of driving around in a truck at 35 degrees when you're hot and sweaty with a colleague in the truck sitting in the seat beside you, putting your mask on. Our own team, we've caught guys where they don't both have the mask on, even though it's policy. So we go back through that coaching process. We go back through all the reminders of why it's so critically important that they do that. So I just think that it's part of what we're going to have to constantly do. And Landscape Ontario and his team of peers and members working together. I know, John, your company's going to participate, maybe handing some of the Don't Let Your Guard Down decals out, or maybe it was Jamie's going to be doing it. I know, Jeff, you'd asked for a couple. But I think our associate members, those that are in front of members and non-members, just encouraging everybody at the workforce level when they leave our shops. We rely a lot on our suppliers because they're another point of contact with our team members, that we're all doing our part as a collective to keep our team safe. And I think that's going to Becky's point, that's going to ensure that whatever happens in the future, we're going to be in the best possible position to deal with whatever comes down the pipeline and keep our businesses running, keep our employees at work, being able to support their families, and obviously keep our clients with the services and the needs they have. Because as we've seen this year, and we talked to a lot of members, it's been a crazy year from a business standpoint, from a people being stuck at home. What do? Well, we can garden. We can go out and plant something. We can look after our yards. So we're seeing incredible business opportunity, but at the same time, with that comes increased risk. So I think we just need to be diligent.
Yeah, absolutely. Well, everyone, thank you. Really appreciate your time. Becky, on behalf of the Landscape Ontario membership and the COVID-19 task force, thank you for the important information that you've shared with us today. And thank you for the very important work you do to keep the people of York Region safe.
Thank you so much.
Thank you.
Landscape Ontario has a bank of information, like we referred to
Yes.
earlier at the COVID-19 hub, the resource hub on our website. So please take a look. There's also a file that we've shared. I'm not sure if you can see that as attendees. We'll also circulate it, but Becky was nice enough to share the guidance document for farm operations. So we have that, and a lot of what's in that guidance document is also applicable to non-farm type businesses. So we'll also make sure that's circulated.
So Joe, just before you close off there, can we also just, for those viewing or those that are watching it online after, the Don't Let Your Guard Down campaign, the PDF is available on the resource hub in the 3 languages. So that's a printable format to display in your safety boards at your workplace or in your shops. That explains the Don't Let Your Guard Down, what it means to disinfect a truck, wear the mask, keep your distances, avoid touch points, or be conscious of your touch points. At the same time, there'll be a couple adhesive decals being made available through this month's landscape trains or Hort review. Those are also available online through Landscape Ontario's resource, where you get your membership decals and everything else for just a cost recovery. Do you know the number off the top of your head, Joe, or anybody else in the task force?
I think a bundle of they come in bundles of 100, but I think we're still.
I think it was $135 or something like that. But
yeah.
These decals are intended for your entry points at work, by your punch clock, on your vehicle windows, on both passenger door and driver's doors, on your skid steers, on your rakes, wheelbarrow, any of the touch points that you think people are going to let their guard down, please, we're making hopefully the costs so low that it just makes sense to have them at your workplace, that you can adhere them to just about everything we need. I think that's going to be the easy reminder. They're bright, they're easy to understand, and it'll allow us at small businesses and large businesses to take advantage of this collective campaign and really do our part as employers and leaders to make sure that we don't see any kind of relapse within the sector, as broad as it is, from the farm right through the garden center and then into the landscape maintenance and design build community.
Yeah, couldn't have said it better myself, Alan. And those decals are going to be coming out in the next issue of Landscape Ontario magazine. I think you called it Port Review. I think you're dating yourself a little bit now.
Look at
right. So it'll act as a sound reminder to don't let your guard down. We've all worked really hard to mitigate the risk and exposure for ourselves, our families, friends, staff, and clients. So it's important to remain diligent and remember that safety is still our number one priority. Thank you all for joining us, and we'll see you next time.
Thank you very much,
everybody. Thanks, Becky. Good night.